NACADA's crackdown on Meru Rehab Center exposes gaps in Kenya's addiction treatment oversight. Meru, Kenya. The closure of a rehabilitation center in Meru County by the National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, has sparked wider conversations about the state of addiction treatment in Kenya. The center was shut down after officials uncovered shocking living conditions, including starvation, overcrowding, lack of medical care, and reports of patients being locked inside for more than a year. Why this case matters. The raid not only exposed inhumane conditions, but also highlighted systemic weaknesses. Many rehab centers in Kenya operate without proper licensing, regulation, or consistent monitoring. Families seeking help for loved ones are often left vulnerable to unregulated operators who exploit desperation. Policy gaps in Kenya. Kenya's Mental Health Act, 2022, and NACADA regulations outline minimum requirements for rehabilitation centers, but enforcement remains inconsistent. Among the key policy gaps: licensing loopholes. Some facilities operate without approval, especially in rural counties. Lack of routine inspections. Oversight is often reactionary, triggered by public complaints rather than proactive monitoring. Weak patient rights protections. Many centers fail to guarantee access to health care, family visits, or legal safeguards against unlawful confinement. Limited public awareness. Families may not know how to verify whether a rehab facility is licensed or accredited. International comparisons. Globally, countries with robust rehabilitation frameworks offer lessons for Kenya. South Africa, rehab facilities must be registered under the Department of Social Development, with regular audits to ensure compliance with patient care standards. United States, addiction treatment centers undergo strict accreditation processes through organizations such as CRF, Commission on Accreditation of Rehabilitation Facilities. Patient rights, including access to medical care and family communication, are legally protected. India. After years of unregulated operations, the government introduced guidelines mandating minimum infrastructure, staff qualifications, and patient rights, with penalties for noncompliance. Kenya, by contrast, still struggles with patchy enforcement despite having a regulatory authority in NACADA. The way forward. Experts and advocates argue that the Meru case should serve as a wake-up call for policymakers. Suggested measures include strengthening NACADA's inspection mandate, shifting from reactive raids to regular, surprise inspections. Mandatory accreditation, requiring all rehab centers to be certified by both NACADA and the Ministry of Health. Public awareness campaigns, guiding families on how to identify safe, licensed facilities. Legal reforms, tightening penalties for unlawful confinement, patient neglect, and operating without a license. Community-based alternatives, expanding outpatient and community rehab models to reduce reliance on poorly run private centers. Beyond shutdowns, building trust. While the closure of the Meru Center is a step toward accountability, experts caution that repeated shutdowns without structural reforms risk pushing the problem underground. For Kenya to restore trust in addiction treatment, the focus must shift from punishment alone to building a sustainable, transparent, and humane rehabilitation ecosystem.